The district ran through its supply of vaccines to treat monkeypox in less than 30 minutes after launching its immunization initiative.
Shirin Rajay standing by in the newsroom with more.
Yeah, Jim, Angie, we're talking about 300 vaccine appointments that were opened up Monday, and within minutes, the city tweeted that all appointments were full, which was kind of shocking for a lot of folks and may lead to some people asking whether or not they need to get a monkeypox vaccine. The state epidemiologist tells me tonight these people who signed up were not at random.
If you look at a case that is confirmed, that case may have multiple close contacts, right? So those are the high-risk individuals. They've been in close contact, and when I say close contact is, skin-to-skin contact, right? If you don't have that skin-to-skin contact with a person's lesion, you're not at risk. You're at no risk in that way. So the whole idea here is the public should not panic at all, because we already know that the threat for the general U.S. public is very low.
Now, Dr. Mangla adds that monkeypox is rare. It's largely spread between people through body fluids or contact with lesions. It can also be airborne, but he says there are no known cases in the U.S. that have been identified as being airborne. He says the folks who signed up for vaccines in the district were either contacted through contact tracing from the 20 confirmed cases now in D.C., or they fit the criteria of being in a high-risk group. That includes those who are gay, bisexual, transgender women, and other men 18 and older who have had sex with men or have had multiple partners in the last 14 days.
How effective are these vaccines?
They are very effective. As soon as you get a vaccine, you get a second dose 28 days after, and then 2 weeks after that, you are regarded as fully vaccinated. The efficiency of the vaccine is right up to around 90% and higher.
90%. And do they need a booster shot?
Nope, absolutely no booster shot. This is not similar to COVID.
As for symptoms, most patients experience only fever, body chills, body aches, and fatigue. Some get some more serious illness, though. That includes rash and lesions on the face and hands that can spread to the other parts of the body. Dr. Mangla says they will continue to monitor the situation. They'll look at the demand. They'll open up more vaccine appointments as soon as they see fit. They're also working closely with state officials in Maryland and Virginia to coordinate that contact tracing. Jim.